Mr. Speaker, I can tell you who is happy that the budget resolution will likely pass the House today. Big Pharma. Pharmaceutical companies are once again escaping any changes to a system which has repeatedly allowed them to prioritize profits over people and drive increases in out-of-pocket health care costs. Companies like Mylan, Turning, and Valiant are jacking up life-saving drugs like EpiPen for anaphylactic shock, Daraprim for HIV and cancer patients, and Nitropress for heart failure overnight, without any accountability. And while the American people increasingly can't afford their medicine, pharmaceutical companies are the wealthiest they've been in years. In fact, median healthcare and pharmaceutical executive pay is higher than any other industry in the United States. And even though taxpayers fund billions of dollars of basic medical research used to develop groundbreaking drugs, pharmaceutical companies often charge Americans many times what the rest of the world pays. Mr. Speaker, Americans can't afford to continue giving pharmaceutical and health insurance executives a pay raise, and many on both sides of the aisle agree. Just this week, President-elect Donald Trump added his voice to that effort, saying pharma was getting away with murder. I agree. They are literally getting away with murder. Because if a mother can't afford her child's EpiPen or a cancer patient can't afford treatment, people die. So I offered an amendment to this budget resolution seeking to lower prescription drug costs, but Republicans refused to even allow debate on my amendment. Instead of fighting to make sure Americans have access to life-saving medications, Republicans are protecting the ability of pharmaceutical companies to continue to shake down the American people. Now, I urge my colleagues to oppose this resolution and instead address these health care costs and access issues that every American knows too well. I yield back.
Gentleman's time has expired. Gentleman from Kentucky reserves. Gentlewoman from Tennessee is recognized.